Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. Did you recently get your sperm count tested and found that it is very, very low? Maybe less than even 5 million or maybe even 1 million per ml. If that's you, then this video is for you because I'm going to tell you what you should be doing next. When you have a very low sperm count, a lot of patients panic thinking that there's no way around it and that their sperm count cannot be increased. The truth is that there are certain causes which can be very, very easily treated, but all you need to know is which test to do and how to go about it. There are only two tests that you need to look at if your sperm count is really very low. The first is a blood test called the FSH or the Follicle-Stimulating hormone. This is a simple blood test in which the lab will draw a sample of your blood and measure the FSH level in the lab and give you the report. The normal level for adult men should be something between 1.5 to 12 or around 15. Now, this is one test that you need to get done and I'll come back to it later. This is a blood test. The other test that you need to do is you need to visit the sonologist or a radiologist and get a measure of the size of your testicles. Now, the size of the testicle is measured in terms of cc. It's like a volume. So the normal size should be around 18 to 20 cc. So if you've got both these tests done, if you haven't had them, please go ahead and do them. Now I'm going to tell you how and why they matter. The first thing that you need to check is, are both these tests normal? That is your FSH level normal and is your testicular volume also normal? If both these things are normal and your sperm count is low, you're in luck. The most probable cause for your low sperm count is an obstruction somewhere in the tract from your testicles all the way to your penis. When there is an obstruction, the sperm's count in the testicles is actually normal, but those sperms are not able to find their way out into your ejaculate. And this can be very easily treated with a simple surgical procedure and your sperm count will immediately come back to normal. The reasons for this kind of an obstruction could be an infection that you had at some point in your life. It could also be congenital abnormalities, which is something that happens at the time of birth itself, because of which there's a tiny little stricture or a little blockage in the tract. Now, this is if both the tests are normal, but what if the tests are abnormal? So the first thing that we look at is, if your testicular volume is reduced, that means your testicles are small in size, we need to know whether the problem is in the testicles or it's somewhere in the brain. Now, the way to do that is, let's imagine that your testicular volume is low and your FSH levels are very high, they are above normal. What does this tell us? It tells us that the problem is in the testicles themselves and the body is trying to get your testicles to make more sperms by raising the FSH level, because that's the only way in which you can make more sperms. The FSH promotes the creation of sperms. So if your testicles are small, your testicles are not responding to the FSH, and so the body is trying to make more and more FSH to increase your sperm production. The reasons for this are usually genetic. There is a problem in your chromosomes. There are certain types of chromosome combinations, I've included one of them here, which can be causing this, and you need to go ahead for genetic testing and you need to talk to a genetic counselor as to what you can do about this next. Now let's come to the last possibility, where the testicular volume is low, so your testicles are rather small in size and your FSH level is also low. Now this too is something that can be treated and you're in luck, because we call this hypogonadotrophic hypogonadism, and this is because the glands in your brain which are responsible for making the FSH are not making enough of this FSH, and that is why your testes are not making enough sperms. This can be treated with medications and it is usually something which has a good prognosis. So you need to consult an endocrinologist as well as your andrologist if this is you. So I've included the three key possibilities that you can have when your sperm count is very low. Please go ahead and get these tests done, and please write down in the comments whatever were your findings so that I can help you more.